whenever we want to study a tissue, we have to understand two important aspects of it. One is the physical characteristics, that is how it looks, the external appearance of the tissue. And second is the chemical composition, what the tissue is primarily made up of. So what the tissue looks like is the physical characteristics. So when you look at the physical characteristics of enamel, you realize that there are a lot of points underneath. And the most important point is the thickness of enamel. Now, enamel, though it is so hard and so tough, it is not evenly distributed all over your tooth. The thickness of enamel is variable. It varies anywhere between 2 to 2.5 millimeters in a permanent tooth and about 1.3 millimeters in a deciduous tooth. So, why is this change between permanent and deciduous dentition? The reason being because permanent teeth are supposed to live with you till you die and even after you're dead, whereas the deciduous teeth are supposed to be with you only for a limited period of time. So, limited period of time, limited mastigation, limited eating habits, and that is why the thickness of enamel required in deciduous dentition is very low. So, that is why in deciduous teeth you will have a thinner enamel as compared to the permanent dentition. Even the composition of enamel in a deciduous dentition is slightly more softer compared to the composition that you find in a permanent dentition. Now, this thickness of enamel is varied in such a way that you will have the maximum thickness of enamel on the cusp tip and the incisal edges. That is because this part of the tooth is going to have maximum mastigatory load. So, whenever you chew onto something, you bite into an apple or you chew onto an apricot, your cusp tips and incisal edges are going to bear that load first. So, in order to help your tooth bear that load and not get stressed, the enamel is maximum thick onto these areas. The importance of this thickness is primarily two in number. That is the sensitivity. So, thicker the enamel, less will be the sensitivity, and that is why your incisal edges are the thickest, because whenever you bite into an ice cream, you don't feel the cold because that enamel is so thick. But with the process of eating and mastigation, this enamel does tend to wear off. And when this enamel wears off, we call it as attrition. So, attrition and abrasion are basically removal of tooth material either by physiological processes, then you will call it as attrition. If it is by pathological processes like brushing, then you will call it as abrasion. So, either of the two, that is attrition or abrasion, is going to result in loss of enamel. And every time the enamel is lost, it can never be reformed. And that is why a person starts feeling the sensitivity as the enamel is lost. So, to avoid all this, the maximum thickness of enamel is provided on the cusp tip and the incisal edges. The primary motive of creating this barrier on your tooth is to give a protective covering to your tooth. And how does this enamel try to protect? Because it is so avascular, it is asensitive, it is absolutely insensitive to all temperature modifications. So, it helps to protect all the internal tissues. And what are the internal tissues? Dentine and pulp, both of which are quite sensitive. So, that is how the enamel will act as a protective covering of the tooth. Now, enamel by nature doesn't have a color of its own. So, it is colorless. But instead of calling it colorless, we actually call it as translucent. So, it allows some light to pass through it, thereby reflecting the color of the underlying tissue. And the tissue that is right beneath enamel is dentine. So, based on the color of dentine and the thickness of enamel, the tooth will take on that color. So, if the enamel is very thick and the dentine's color is getting masked, then the enamel will appear grayish white. But if the enamel has been removed because of either physiological or pathological processes and the dentine color is getting reflected, then the enamel will appear yellowish. So, that is why, have you noticed that as people age, the teeth start becoming yellow? That is because the enamel's thickness has started reducing and the color of the underlying dentine has started being exposed. So, that is how the teeth change their color from milky white or grayish white to yellowish white. At the same time, if you look at children, Their teeth are milky white, very bright and beautifully white. You will never have a child with yellow teeth. The reason for that is that though the thickness of enamel is less in the deciduous dentition compared to the permanent, the thickness of dentine is also less. So, automatically what is happening? The color of the dentine doesn't get reflected so much, and that is how a child's teeth appear milky white. Whereas in the adults, because these teeth erupt anywhere between the age of 6 years and then they continue till you die, so there is gradual wear away of the enamel. And that is why the adults, the teeth do take on a yellowish tinge as a person ages.